So a typical week varies depending on what year you're in, but sort of a typical week for a fifth year. A Monday morning I would start on the dental emergency clinic, so you're seeing patients that need to be seen as an emergency. They've called 111 and come to see you, so sort of anything can walk through the door. Monday afternoon normally I'd have sort of self-study, so that's either doing lectures at home or revision or working on an assignment, something like that. Tuesday morning I would be on the paediatric clinic, so treating children patients, and then Tuesday afternoon would be on what we call the advanced restorative clinics. That's sort of your everyday dentistry, doing your fillings and crowns and bridges, dentures, that kind of thing. Wednesday morning would be that same clinic, so just a normal restorative clinic, and then Wednesday afternoon self-study again. Thursday morning typically I would be on outreach, so that is where we go to a centre sort of in and around the Newcastle area and treat patients in community, so that's a little bit of a nice change of scene. Thursday afternoon, again, either self-study or we'd often have seminars on a Thursday afternoon, and then Friday morning we would be on the restorative consultant clinic, so it's a clinic that's run by the consultant, but you're sort of seeing their patients, and it's a great learning opportunity, often a lot more complex things, and then a Friday afternoon self-study again to do lectures or whatever else you're working on at the time. I think the biggest thing that was quite a shock when I came here was how much there is to know. People would often joke, 5 years to study about teeth, but there is so much more to it than that, from starting from the beginning. You learn the anatomy of the head and neck, but also pretty much the entire body and all of the organ systems. You learn all the intricate cell biology, so human cells and bacteria, things like that. All of physiology and things like that before you even get onto teeth. So there is so much to know. But I think as long as you enjoy biology, I found it all very interesting, and it very much all builds on each other. So the things you learn in the earlier years then build, and it can often seem a little bit irrelevant, but over time you realise the pieces come together and it just helps build your knowledge and improve your understanding. It's not so much about the course, but sort of dental school life is the sense of community. I was quite surprised, we are such a small cohort, but everyone gets to know each other really, really well. But also working with the staff here, they treat you a lot more like colleagues than there's not that sort of hierarchy. We all have a mutual respect for each other. But even between year groups, people are very close. There's that massive sense of community. You can speak to anybody about anything. And with it being a 5-year degree, we're here a lot longer than other students. You do get really, really close. So yeah, it does just feel like quite a big family, which is really nice. Before I came, I think I expected it to be very official and, quite standoffish and maybe a bit like it is at school. But it's very much a community where everyone feels very welcome. So a clinical placement is where you use sort of the knowledge and the skills that you've acquired from textbooks or simulation, and you apply it to learn in the clinical environment, but it's still a teaching environment where you're supported by members of staff. Obviously with something like dentistry, there's only so much you can learn from textbooks, and only so much you can learn from sort of phantom heads and simulation. You do very much just need to get stuck in there, see some real life mouths. So from sort of the start of third year in dental school here, you are on clinical placements. We're very lucky that we're based in the dental hospital here at Newcastle, so the majority of our clinical placements are here on site. So sort of like I mentioned before, we have the emergency clinic, we have oral surgery, we have the radiology department, the restorative clinics, the children's clinics, sedation department. Throughout your time as a student, you rotate around all those clinical placements, and the things you learn in the textbooks and from lectures you apply to real life, but in an environment where you're supported by staff and you can, get that support whenever you need it. So here at Newcastle, we start treating patients at the start of our third year. So you've had the first 2 years to learn a lot of the theory, and then you have a clinical skills session at the end of second year to sort of prepare you for seeing patients at the start of third year. I remember being so nervous. I actually started, the first ever patient I saw was on oral surgery, and I remember I had the patient's notes in my hand and I was stood in the doorway and I just couldn't get myself into the waiting room to shout their name. I was so nervous. And I remember thinking, God, if I'm so nervous that I can't even shout the name, like how am I going to take their tooth out? How am I going to pretend this isn't the first time that I have put a pair of forceps in someone's mouth? But again, the support around you is fantastic. And I think with something like dentistry, you just have to get stuck in at the deep end. There's only so much you can do that's not real life. You just have to do it and sort of pretend the best you can that this isn't the first time you're doing it. But yeah, after a couple of times and, you know, you get into the routine of the right thing to say, yeah, the support is fantastic. So you get used to it quite quickly. But yeah, very, very nerve-wracking to start off with. I personally quite enjoy just the restorative side of dentistry, so that's like your everyday dentistry, doing your fillings, making dentures, things like that. And sort of part of that, like I mentioned before, on the consultant clinics, we see a lot more complex cases, seeing those patients, diagnosing their conditions and helping come up with a treatment plan, especially if it's quite a complex treatment plan that you know is going to take some time. I find that really interesting. I really enjoy seeing patients sort of along a similar line there, where if they haven't attended a dentist for a number of years, you know, they've got quite a lot of neglect in their mouth, or if they're really struggling with their oral health and you know that the treatment that you're going to do is going to make a massive difference, whether that be like getting them out of pain or providing them with a denture, something that you know has a huge impact on them, both physically, functionally, how they can eat and smile, and also with their mental health, their confidence and things like that. Things that I find quite difficult, I suppose, managing patient expectations. Often patients expect a lot, and I think it often comes from a place of not quite understanding how things can work. So explaining to a patient why things are working a certain way, what the options are that we have to help them out and what that might look like. That can sometimes be a little bit difficult, sort of getting on the same level. And along the similar lines, patients, you know, you always get a difficult patient, but again, it's all great experience, just learning how best to communicate with those patients and working in a way, you know, where you're working together. You need their help as much as they need yours, but generally all positive, I'd say.